very good morning, everyone. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be doing really good. Today, we are going to discuss about our skin health with focus on psoriasis. Now, psoriasis is a condition in which skin cells build up and form scales and itchy, dry patches. Now, psoriasis is thought to be an immune system problem. Triggers include infections, stress, cold, and the most common symptom is a rash on the skin. But sometimes the rash involves the nails or joints as well. It can start in any age, but most often develops in adults between 20 to 30 years and between 50 to 60 years old. It affects men and women equally. But in today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, and the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, today we have with us renowned dermatologist Dr. J. Joseph Jenson, who is a consultant dermatologist based in Chennai. He completed his MBBS from Chettinad Hospital and Research Institute, Tamil Nadu, and MD Dermatology in Kasturba Medical College, Manipal. His experience lies in PRP, various aesthetic procedure for facial rejuvenation, laser treatment for acne scars, tattoo removal, vitiligo, Botox, and so on. He participated in various national and international conferences. He also presented and won many papers and poster at state and national level conferences. A very warm welcome to you, Dr. J. Joseph Jensen. It's a pleasure to have you with us today.
It's a pleasure, ma'am, joining the on Facebook Live to the StreamYard platform. I'm really excited about this webinar and sharing my insights about the psoriasis.
It's equally thrilling to us, and we are really looking forward for this session because today the topic is what is psoriasis.
Yeah, ma'am. So, am I audible, ma'am? Is it audible, right?
Yes, absolutely, loud and clear.
Well, yeah. Yes, ma'am. Okay. So, ma'am, actually, psoriasis in a layman term, it's nothing but it's a chronic disorder, ma'am. I can't say it's a disease. Earlier it was considered to be only a skin disease, but right now, it is a multi-systemic disease, ma'am. You have this involvement of along with it, you have multiple systems involved. So, we can't take this as a very isolated problem, ma'am. So any other systemic conditions also, we should try to think about the factors, and there are so many other triggers also. So in a nutshell, I could share that psoriasis is earlier, which was considered only to be an isolated skin disorder, is right now could be linked with so many systemic conditions, ma'am.
Right. Doctor, we all understand that, there are so many and various kinds of skin infections, skin allergies, and almost all of it start with a rash on the skin and infections. How does it look like? But before that, what causes psoriasis, doctor?
Ma'am, actually, the causative factors, or I could say the causative agents, are multiple, ma'am. So, psoriasis as it's an autoimmune condition, ma'am. So, the immunity against the body, it is an autoimmune chronic condition where it is caused by multiple issues, ma'am. Earlier, the first thing which you could look upon is genetic factors, ma'am. So many genetic factors play in a role. Actually, just like diabetes, no, we can say this as type 1 and type 2 are the two types, ma'am. Type 1 occurs in the earlier in age, and type 2 is associated with later onset disease, ma'am. And the other things are there are so many genes involved. You can see the CW6 gene or the ROS1 gene, and all there are so many genes which are involved, and we there's a genetic theory called anticipation theory, ma'am. If the father develops psoriasis at an age of 50, the child will have a issue, could have an at an early age. So it anticipates earlier, and it could manifest in a very early age in genetical cause. Other than the genetical cause, there are so many other causes, ma'am. You can see the infection triggers, especially in children. When you can see any streptococcal infection, it is very difficult to clear the streptococcal because it affects the cell. So when it affects the cell, it could trigger a lot of other reactions causing the inflammation, ma'am. Other than that, infections, you can see even some drugs causing it. I mean, old age groups, you can see the cardiac drugs such as beta blockers, even the lithium. And one such drug when we use for COVID, no, hydroxychloroquine, again anti-malaria drugs are one of the main triggers in aggravating psoriasis. So these are the few things which you can attribute for. And also, it is a condition of winter. I mean, generally, you see that whenever winter is being prevalent, you see that psoriasis has been aggravated. So why? Because the dryness of skin. So when you have skin being dry, you have a tendency to itch, ma'am. And also, when the skin is dry, because of the intense inflammation caused in psoriasis, there is barrier dysfunction, ma'am. So when the skin barrier dysfunction has been dysregulation is held, there is the skin cells become hyperactive and then inflammation sets in, causing the aggravation of lesions.
Right, doctor. You have very well explained what are the various causes, what triggers psoriasis, etc., etc. And as you said, winter is one of the worst seasons because it makes your skin more dry, and of course, it gives psoriasis to grow, or it becomes even worse. So the patients are always complaining about psoriasis, especially during winter. Now, as we know, we are experiencing winter in almost all parts of our country, and for the patients who have psoriasis, it becomes very difficult to take care of it. What can we do, doctor, especially during this weather, to take care of our skin, and how to prevent psoriasis at the very first stage, and in case we have, what to do then?
Ma'am, as such, no, the primary utmost care lies in moisturization, ma'am, because that is the most important thing we have to look upon, ma'am. So we classify the moisturizers based on what conditions we have. See, if your skin is basically dry, it is better to apply like hydrating, very well hydrating moisturizer. You can use the ceramide containing moisturizer. Though the moisturizing effect is very temporarily present. So what you can do is that you can apply something like topical moisturizers which have ceramide so that the effect is very long lasting. Second thing, if you have the kind of skin which is very dry or very kind of thickish skin, you can use moisturizers containing keratolysis such as urea, something so that it will try to make the skin little more subtle and a little more supple so that because the main issue here is if the skin becomes dry and if the skin is becoming thick, we have a normal tendency, ma'am, to itch the skin. So the basic thing is to reduce the itching, ma'am. So our basic ideology or the basic attribute of preventing psoriasis lies in complete moisturization, ma'am. And the thing is, we and many people or many people will say that yeah, after adequately moisturized, but it's the frequency of application, ma'am. That also plays an important role, especially in winters, ma'am, because your skin is already dry and the cold air which is being or the dry weather which is prevalent will make your skin more dry, ma'am. So the frequency of application is very pivotal in preventing psoriasis. So you have to apply moisturizers at least thrice or four times a day, ma'am, at least. So that will give an adequate hydrating effect, and thereby it prevents the dryness, ma'am. So which you can do. Other thing is that especially when we take bath, no, ma'am, don't take. We should not use any hot water because more the temperature is there, it will try to have a stringent effect, like it will reduce the water staying in the skin, ma'am. So the basic thing is, and the best time of applying moisturizer is that after 10 minutes after bath, ma'am, because what it does is that there is something known as the transepidermal water loss, ma'am. So the skin, when our skin has a basic tendency to lose water generally, ma'am. So after bath, when you apply moisturizer exactly 10 or 15 minutes after the bath, the moisturizer seals the barrier, ma'am. So your barrier is intact right now, and that barrier will try to prevent the exit of water loss. So that will keep hydrated, ma'am. That is one technique which you can and you can use it regularly. Another important thing is that, especially during night, ma'am, so that it is better before going to bed, that you can apply a moisturizer at a very elaborate way, so that it can doesn't cause any other itching at a night or something which can progress. And one more thing is that what you can try to do is that apply, even when there is no winter, because that is the thing which you many patients say is okay, if the moisturizers are a little costly, or even for cost effectiveness, we can use at least like liquid paraffin or white soft paraffin combinations which are available in the market easily. So that will try to enhance your hydrating effect. And still, if the patient doesn't have any topical, they are not being satisfied with topical moisturizers. There are so many oral moisturizers which are available in the market right now, which you can intake, which have a good intake, and so that it will hydrate the skin, ma'am.
Right. So, keeping your skin hydrated is the mantra. So, in case you want to prevent psoriasis, even if you have psoriasis, keep your skin hydrated because dry skins are more, prone to psoriasis. Now, doctor, in our society, we are so obsessed with home remedies. These days, we have these DIYs, because there are so many influencers on various social media platforms preaching about specifically about skin a lot, and not all of them are dermatologists. Now, my question to you is, do these home remedies, these DIYs, or over the counter topical applications, etc., or what my friend and family did when they have psoriasis, their prescription, does it really work? Or we need to go and consult with a qualified dermatologist like you to get it treated properly?
Ma'am, very good question, ma'am. Especially in the era of social media, and you have the Instagrams and all. There are so many market, even in the threads and whatever it is. So the thing about psoriasis, there are so many misconceptions, I could say, ma'am. Why it is imperative to treat to get a dermatologist that to see a dermatologist that when you because psoriasis can mimic a many of things, ma'am. So psoriasis can mimic a fungal infection. Psoriasis can mimic a viral induced pityriasis rosea or something. It is a lot. It has a lot of mimics, ma'am, and you just can't be like this. We can't say like mathematics where two plus two is equal to four, ma'am. Why I'm saying this, especially in psoriasis, because psoriasis can be classified or clinically it has very diverse variations, ma'am. For example, I could say psoriasis can be in the morphological form. It could be a patch-like psoriasis, or which you can see extensive psoriasis, which is called ectodermic psoriasis, or when you see in skin like in children or someone with small raised red lesions, which is called as guttate psoriasis. And also, it is the one more difficult thing about psoriasis which occurs is it is site specific, ma'am. See, for example, psoriasis can occur in the scalp, psoriasis can occur in elbows, psoriasis can occur in the areas where sebum secretion is more, that is called as the seborrheic areas, that is the acne prone areas. You can develop around the nose, you can develop around the eyelids, you can develop over the center of the chest, or you can develop at the back of the chest. So these are the areas you can prone. And even what is the strange thing is that generally we earlier we used to confine to certain sites, but right now we say that the sites are also being very new sites are developed. For example, we developed isolated nail psoriasis one. Sometimes we develop isolated genital psoriasis. Sometimes we develop psoriasis in the groins or foot. So these are the variants which are very difficult to treat, and just by normal examination is without the intervention of a dermatologist, very difficult to diagnose them, because only when your diagnosis is right, and then you can try to treat on which condition what is in them. Number two is that the OTCs which are available. See, there are easily through Instagram we can say that yeah, you can apply this for this and this for this. That is fine. But the problem is if you have the thickness of plaque, so many factors decide the topical application, ma'am. So, see, what I could say is that they say generally, yeah, you can apply topical corticosteroids and that will heal. No, it is very difficult, ma'am, because you apply topical corticosteroids for a longer time. The effect of the topical steroids, weans, ma'am. So that is called as tachyphylaxis, and you need something or some other intervention to or an alternative to find a solution. So per se, I say that only one cream or without some intervention, you can't just blind treatment issues. You need a proper clinical diagnosis. Whether you have to confirm whether it's classical psoriasis or something related mimicking like psoriasis, and the cream which you give is very important, ma'am. So that is why the dermatologist's role is very important, is very vital in diagnosing the condition and treating it,
Right. Proper diagnosis is very important. We all are individuals. Our skins, our problems are so different from others. So we need to have an individualistic approach, and only a qualified dermat can help us with that. So in case you have psoriasis, please go and consult a qualified dermat. That's really important. Now, doctor, when a person comes to you with such signs and symptoms, just by clinical investigation, you're sure that this is psoriasis, or there are any tests that you normally recommend for the proper diagnosis?
Yes, ma'am. Very good question, ma'am. Actually, this we can put in two ways, ma'am. Actually, one basically, psoriasis is a cutaneous disorder with clinical diagnosis being the first important thing. But right now, because there are so many mimics, there are so many mimics of psoriasis, we can try doing a biopsy if required. Histopathological biopsy can aid in your psoriasis diagnosis. And something handled dermoscopy, it's a stethoscope of dermatology, which I could say proudly. Dermoscopy can help again in diagnosing clinically along with the clinical signs. If the clinical signs are if the clinical signs are very well clear, then it is fine. But when you have some kind of morphological alterations which mimic psoriasis, I think biopsy is the gold standard one, because dermatology has the dermatopathology being the base, so the biopsy can help in clinically diagnosing like psoriasis. And one more thing is dermoscopy of the recent advances, which you can think of, and which you can. There are a few scientific things in psoriasis which you can diagnose from. So these for this diagnosis I can put, and therapeutically investigation wise we require so much because nowadays the inflammation is very widespread now, and so it is the cutaneous disease is extensive now. So only with one cream or something you can't treat. I may require some other intervention which you can try. We may require some oral tablets which you can see, and the oral tablets which you use is not it is an immunomodulator. So we give an immunomodulator that could have your remaining blood system intact, that is the hematological component intact, your liver intact, your kidney intact. So these kind of blood investigations plays an important role in therapeutic evaluating them. So you can put it in two ways: one in diagnostic way, the clinical findings, and the therapeutic way. You do some kind of investigations, and then we decide what is the important thing. And one more thing, right now I could try to elaborate this, ma'am. The involvement of systemic drugs, which I told in my first part of the webinar, that is now psoriasis is highly linked with obesity. That is called as metabolic syndrome, ma'am. So now psoriasis is interlinked with your increased BMI, your weight increase in weight, insulin resistance, hyperlipidemia, and hypertension. So these are the things which are so much linked in psoriasis, so that even when you find a patient with insulin resistance, you think, okay, you can even think of metabolic syndrome if he has psoriasis with insulin resistance or with obese. So that is how psoriasis has been interlinked right now.
Right. So, doctor, a very common question that people often ask, especially the patients, is that is psoriasis completely curable? And what are the treatment options available? If you can shed some more light over that.
Ma'am, this is the most difficult question which every dermatologist faces, ma'am. The problem here is, ma'am, that actually it is one good and bad. I could say the good thing always was for generally diabetes and all, you have to take tablets daily, or for hypertension you have to be like, or even thyroid disorder, or some endocrinological disorder, you have to be on in with treatment daily, ma'am. So because there is, in case of diabetes, the insulin resistance is profound, so we have to supplement some kind of oral medication daily now. But the problem here in psoriasis, the advantage here and the good thing is, if it comes, you can take the treatment. So you can try to, when it is in when it is cleared off completely, you just need to apply the moisturizers alone. You need not take the other treatment. So when it comes, you can just treat it, ma'am. So but it depends on what stage it comes, and the intervention likely is depending on the stage, ma'am. The bad thing about here is, no, ma'am, it doesn't have any. See, there are so many treatment options. I mean, you have basically from a basic topical cream to you have the highest level of biologicals which you can treat psoriasis, ma'am, which are the recent advances which have entered the field and has been very good. But the problem is, ma'am, I can't, or no, leave with me, ma'am. Any dermatologist can't go for a prevention of psoriasis, ma'am, because psoriasis can have multiple triggers. As I said, when you have sleep deprivation, you have psoriasis. When you have the calcium levels going down, you can have a trigger of psoriasis, and the drugs causing it, or the seasonal effects, or even the genetic factors. With so many interplay factors, all these factors are interconnected, ma'am. So if you have one factor which you can isolate that factor, and if that factor doesn't have any complication, doesn't have any severity, that could be treated. But because you have interconnection between all these factors are interplayed, so these are the things which you can agree with psoriasis, ma'am. So that is the most difficult thing of psoriasis. So that is why we could always say that psoriasis is never can't prevent the relapse of psoriasis. So only when you get the condition, you treat it and you try to maintain it, ma'am.
Right. So the bottom line line remains that in case you have the signs, please visit the doctor, a qualified dermat, as soon as possible so that they can take care of it. And trust your doctor. That's really important. Complete the treatment, apply moisturizer, etc., and it will help you in getting relief. Now, doctor, many times we have heard people saying that sun also, in a way, helps with the patients of psoriasis. What's your take on that?
Ma'am, actually, right now, actually, this is I could say in two things, ma'am. Actually, in the Indian countries, I could say maybe the Indian setup is very well observed that sun is a very good factor, ma'am. Because even for treatment aspects, we give phototherapy, ma'am. Phototherapy is one. You have the UVB rays, which is sunlight has UV rays, UVA rays, UVB rays, and everything. Those are the things which help in the treatment of psoriasis. So that way you could say that sun protects them actually. You have the phototherapy which has the basis of UVA rays and UVB rays. Now and right now we nowadays we use targeted phototherapy. So that also is as an important part of the treatment of psoriasis. And also generally they say that because only in the Western countries they say that right now component ma'am, that the sunlight can aggravate psoriasis, but right now I could mostly say that sun aggravates psoriasis. So it has been a beneficial factor in treatment of psoriasis. Man. Even when you take this psoralen from like photochemotherapy, that is like 8-methoxypsoralen or something. When you take it in the morning and expose your sun, those are the treatments available which are really useful in treatment. So that is the greatness of the sun being an important role in the alleviation of symptoms.
Right. And doctor, psoriasis also many a times affect our nails, joints. There is also a term called psoriasis arthritis. Would you like to shed some light over that, doctor?
Yeah, ma'am. Actually, yeah, this is again one more important clinical aspect which psoriasis, as I could add to my list of the psoriasis being a multifactorial disease. Psoriasis per se can affect the nails, ma'am. Isolated, actually, we may think the nail is a very small unit of our hand or your fingers, but nail psoriasis can cause a lot of distress ma'am, because the nail in psoriasis can involve all the parts of the nail. Ma'am. It can involve the nail plate, the nail bed, and even the skin surrounding the nail. And it can, if the nail infection, if the nail psoriasis is untreated, even it can erode the bone, ma'am. So that's how severe it is. So you can see what happens, and even what I could say, even the joints. Actually, the psoriasis and the joints. We can classify a small joint involvement and large joint involvement. Even isolated joints can be involved in psoriasis, that causing a single joint disease or a single, or it can involve the skeleton also. It can involve the axial skeleton also. So it has so much implications in the arthritis also. So it is very important to have a clinical diagnosis when you have a psoriasis, and when you have a patient with joint pain. You can't think of the risk of psoriatic arthritis, ma'am. That is the most important thing. Psoriatic arthritis again has to be differentiated from rheumatoid arthritis because we generally that it is the same, but both are different, man. Because in rheumatoid arthritis, the most important thing, the treatment is steroids. But in psoriasis or psoriatic arthritis, if you give oral steroids, it will aggravate the condition. And the tendency of the psoriasis can form into a pustular psoriasis or some kind of erythrodermic psoriasis. So it is very riskier uh, uh, it is very that is why it's very imperative to set in the diagnosis earlier. So differentiate from your
Right.
rheumatoid arthritis and see what the condition is, and then you treat it accordingly. Then. So you can use an NSAIDs if required, or it may or methotrexate again. Methotrexate for can do wonders in psoriatic arthritis, inclusive of psoriasis. So that has been a very good treatment option. So as I said, the joint involvement cannot be taken lightly. And any joint, it could be a single joint or a multiple joint involvement, or it could be a skeletal involvement or something. Everything has to be looked upon in psoriasis, and you treat it accordingly.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, ma'am. Take home message is that, ma'am. First of all, I could say why the most important is the mindset, ma'am, because every dermatological condition is linked with your skin and mind are so much interlinked, ma'am. There is the neurocutaneous axis and everything. So what I could say is that if even if you develop kind of psoriatic lesions or something, you should be stress free, ma'am, because those when anxiety and depression sets in, your inflammation increases, ma'am. So I just want you can do a lot of home remedies like yoga, or you can do a lot of exercises, because exercises or yoga will try to divert your mind, and so that way it will try to reduce the inflammatory stress. And when you reduce inflammation, then that is the most important thing which you can ask him for treatment. Number one, and second thing is that, as I said in my the gold standard of this therapy is that you hydrate the skin and you moisturize the skin adequately, ma'am, because those are the important things which you can do as a basic. As a daily routine basis, so that you try to prevent the complication which sets in. You try even you try to arrest the kind of progression of disease which you foresee, ma'am. So that is the important thing which which I could say. And the most important thing, you see the dermat, and the consultation which you take, the dermat will say that after 2 or 3 weeks, or the review after for investigation. That is very important, ma'am, because that is the most important thing which you will try to. For example, a patient would have been taking some methotrexate. Unfortunately, the levels of hemoglobin may go down, ma'am. So it is very important to visit a dermatologist, and if he says for a repeat liver function test or repeat hemoglobin, it is very important to take those tests, ma'am, because when you because unknowingly the patient may develop something tiredness or something. So the intervention with a dermatologist, especially in active stage, you should at least look for a dermatologist at least once in 2 or once in 3 weeks. And in maintenance therapy, you may ask the dermatologist what treatment to be taken, so that if we can give for a longer period for some 4 to 6 weeks, that is fine, ma'am. But when he is completely disease free, or when the episodes of the clinical features are not being seen evidently, then the patient can rest, and just he can use moisturizers, so that can prevent the disease outcome.
Right. It was wonderful talking to you, Dr. J. Joseph Jenson. It was such an informative session. Thank you for making it so. Thank you so very much for joining our session.
Thanks a lot. Thanks a lot for ITCA team for making this webinar come true, and it's a great pleasure speaking to you, because I asked for this time, because generally the webinars do occur in the afternoon time. It was great of the ITCA team
Right.
to coordinate with this time, during this time, and especially with the holidays ahead, because this has been a holiday period. So thanks for joining during the
Mm.
holiday period, ma'am, and it was a very delightful session, ma'am. Thank you, ma'am.
Thank you, Doctor. It was a pleasure. And viewers, thank you for your active participation in today's session. To get the latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you, and have a great day ahead. Goodbye.